Hi, I'm Dr. Karen Osborne, and I'm going to be talking about what happens during an IUD insertion, the pain relief options available at Clinic 66, and what you should consider when you're choosing which option is right for you. We conduct a consultation with you before you have your IUD inserted, so that's a good opportunity to answer any questions you might have. We sign all the paperwork and we decide whether you need to have some testing done, like cervical screening or STI checking as part of your procedure. We then go through to the examination room where you'll undress and put on a gown, and we get you up onto the examination bed. Once we start the procedure, it's a relatively quick process. It's usually over and done with within about 5 minutes. And I'll just talk through the steps of that process. So the first stage is we do an examination called a bimanual examination. So that's 2 gloved fingers inside the vagina with a second hand on the top. And this is done to determine which way around your uterus is tilting. So between the 2 hands, we can feel whether your uterus tilts forwards or backwards. And that enables us to know which way around to place the instruments. We then put a speculum inside the vagina. The speculum is the duct-building instrument that holds the vaginal walls open, so we can see your cervix, which is the neck of the uterus that we place the IUD through. We then clean the cervix and the uterus with antiseptic fluid to stop any bacteria from being introduced higher up into the uterus. Put a little clip on the cervix to steady it. So putting the little clip on the cervix can give a brief pinch. Some women don't feel it at all. Others do notice it quite a bit. And it feels like a pinch, and it lasts for a few seconds. We then measure the inside of the uterus with something called a sound. The sound measures from the very bottom of the cervix to the very top of the uterus. And that tells us then how deep to place the IUD. The IUD is then placed to the very top of the uterus in a special inserter. The arms are deployed, the inserter is removed, we cut the threads, remove all the instruments, and it's all in place. So it's important to note that whenever anything goes to the top of the uterus, it can give you a strong cramp, very temporarily. So like I said, usually over and done with within a few minutes, but those few minutes can be quite uncomfortable, and you can get some strong menstrual type cramping during the process. After we've placed the IUD, we then take a quick ultrasound, a transvaginal ultrasound, just to check the position of the newly placed IUD and make sure it's in the right place. So many of our patients will opt to be awake for their IUD insertion process, and as long as you are calm and relaxed and you don't freak out with medical procedures and you understand it's going to be a bit uncomfortable for a few minutes, but it's only a few minutes and you're going to get through it, most women will be absolutely fine being awake for their insertion process. And we do definitely recommend that you take some pain relief about 45 minutes before your procedure. Something that you would normally take for menstrual cramps or period pain is a really good option for this sort of discomfort. We do have some numbing gel that we can introduce high in the uterus. It's in a big long syringe, and it coats the inside of the uterus and the outside of the cervix. That helps to numb and to lubricate, and it dulls down any sharp feelings that you might get during the insertion procedure. And it's a particularly good option for women who haven't had a vaginal birth, but who want to have an awake insertion. We also have something called Penthrox, or the green whistle, which is an inhaled pain reliever and has some anti-anxiety properties as well. So this is actually quite a useful thing to give if you're either a little bit anxious or you're experiencing a higher level of discomfort than usual during the procedure. We do have the option of intravenous twilight sedation. So what this means is putting you off to sleep for like 5 to 10 minutes while we place the IUD. Although you'll only be asleep for about 5 to 10 minutes, you are usually here in the clinic for about 3 hours, as this is done as part of a day surgery admission. And we do need to make sure that you wake up okay in recovery. Most of that time is spent doing paperwork or waking up afterwards. While you're sedated, so sedation would be done with something called a cannula. A cannula is put into the inner surface of the elbow, and some medication is put through the cannula that puts you off to sleep. That gives you good pain relief, but also has some anti-anxiety properties, and you're totally asleep while the IUD is being placed. We do say that you can't eat for 6 hours before the procedure because you do need to be fasted in case there is a risk to your airway. And you can't operate any heavy machinery or drive on the day of the procedure if you're sedated. So you do need to be dropped off and picked up by somebody else who can't drive a car that day. Now, who should opt for what option? So there's no hard and fast rules about this. And so we generally just give some advice. Like I said, most women will be fine to be awake for their procedure if they are the type of person that can relax and they're quite calm and they don't get anxious. They don't feel faint easily with medical procedures. They know it's going to be a bit uncomfortable for a few minutes. They will usually be absolutely fine for their insertion process if they wanted to be awake. For women who do feel anxious or do have trouble with vaginal examinations, perhaps you've had trouble with a pap smear or a cervical screening test, or it's been quite uncomfortable or painful, or perhaps you have a condition called vaginismus where your vaginal muscles clamp quite easily. All of those women, I would definitely recommend that you consider having sedation for your procedure. Similarly, if there's been any surgery to the cervix in the past, so surgery might have occurred if you've had an abnormal cervical screening test in the past and needed to have some surgery to correct that, there may be scarring, and that scarring may make the procedure then much more difficult. And we would recommend that you opted to have sedation for that. If you do easily faint with medical procedures, it's also a better idea to be sedated because we can then give you extra medications very easily if you do feel faint afterwards. So those are all of the options available at Clinic 66. If you still haven't decided, please make an appointment with any of our doctors and they'll be very happy to talk to you more about all of your options. Thank you.